don't talk about often on this show, and I don't think we talk about very much as a society, which is why I wanted to talk about it today. Rare diseases, by definition, they don't happen very often. But there is an event on Friday in Stoke-on-Trent where that will be the focus. All about how to live well if you've been told you've got a rare disease. I have no experience of this myself. My diseases, ailments and illnesses are all too common. If you've got kidney stones, you'll know how I feel. But if you've been told you've got something and you're only 1 in 300,000 or 1 in 1 million or 1 in 10 million who's got this, what kind of support do you get? And what kind of help is out there and who do you turn to? Kirsty Hoyle is Chief Executive Officer of Metabolic Support. She's running this event in Stoke on Friday, and she's with us on BBC Radio Stoke this morning. Good morning.
Good morning, Stuart. Thank you so much for having me.
Oh, it's a pleasure. Thanks for talking about this, because people don't, do they? First of all, a couple of ground rules here. When we talk about a rare disease then, Kirsty, how rare does something have to be defined as rare, if you see what I mean?
There are different definitions of that, but one good statistic I think it's useful for the UK context, Stuart, is that 3.5 million, or roughly 1 in 17 people living in the UK actually have a rare disease. So you're right that we are individually rare, but we're collectively common in our society.
So when someone gets diagnosed with a rare disease, what happens? Because if you get diagnosed with a common disease, there are lots of big, well-known, often international organisations and support groups that can help. If it's something rare, I suspect there's less support. Is that right?
Yes, and it can vary. I mean, to your question earlier, it's broad, depending on the definition, but broadly, 1 in 2,000, fewer than 1 in 2,000 people having a condition can be considered rare. So we're not talking about huge numbers, but that doesn't mean that the quality of the care and the support that they need is any different to conditions and support needs for wider communities. And it can also vary very much depending on your condition, who is interested in that condition, where you live, and also, Stuart, health inequities and your own personal life can really play a part in you getting or not getting what it is that you need.
What do you mean by that?
So there's definitely an element of, for example, my son has a rare disease, which is one of my reasons for the interest in this community. And I am somebody who has a level of education and privilege and understanding that I am able to navigate and carve a path for him that means that he is more likely to have positive health outcomes than perhaps other children and people potentially who do not have those resources available. There's definitely an inequity across our society for people with a rare disease in that regard.
I'll put this politely. Do you have to be a bit pushy then? If it's a rare disease and people don't perhaps understand it, and GPs, for example, have a very broad remit, and if it's something that affects very few people, they may not know much about it.
Right, absolutely. I mean, I have instances where I've been with consultants trying to impress them, because you want them. There is very much an individualistic relationship, and I think we are expected to be experts, but then also to stop that when we become too much. There's a very interesting dichotomy between being a patient expert and being a problem patient, Stuart, and so sometimes it can be difficult to navigate that process.
How much research have you done into your son's condition then? Loads, I would imagine.
Yeah, and I'm pleased to say I'm about to be a trustee of his community. But as example, Stuart, I once turned up to an appointment and I'd taken the day off work and it cost me £80 to £100 to facilitate this day. And the appointment was cancelled last minute. And these kind of things happen quite a lot across our society. And also, as you say, if you have to have the emotional burden in terms of understanding your children's condition and the financial issues, there can be a moment where this can become too much for people. So yes, having a rare disease in particular, because there is a lack of understanding and the diagnostic journey is around 5 years for a diagnosis. So it's not just understanding the rare disease, it's understanding which one it is in the first place.
Yeah, so when people get diagnosed, and I'm sure this will vary depending on the disease, of course, but are you pointed in the direction of support?
Yes, So let me give you an example. The organisation I run, we cover about 17% of diseases. So we cover about 1,500 that sit under the 6,000 to 7,000 diseases. And in the UK, we have a newborn screening panel. So when your baby is born, at the moment, we test for 9, soon to be 10 conditions. And 7 of those, it's not the only way to be diagnosed, but it's the biggest filter in our country, Stuart. And if you are diagnosed with one of those conditions, you will hopefully be referred to an organisation like ours for your support, but you will be then referred through the healthcare system for your medical needs. But that's only 10 conditions that we test for at birth.
What does living well mean then? You've got kind of the Living Well movement. You've got this event coming up very soon on the 7th, so on Friday. What does it involve?
Well, 95% of rare diseases don't have a treatment. There is no cure for those conditions. However, the narrative surrounding rare disease can be very focused on finding a cure, race for a cure, and the burden of living with a rare disease on both the person living with it and the family. I'm sure you've seen, Stuart, lots of GoFundMes around this in the past, races for cures. But the reality is that for most of us, there are none, and there won't be in your particular lifetime. So the Living Well movement is an acceptance and understanding of what can be done, not just what could be done. So we're very supportive of treatment developments. Absolutely. This is a project that looks at what else we can be doing whilst people need to live well now, not just looking towards the future of treatments.
So the event on Friday, why is it needed, and can anyone come along to it?
They can, and so far we've got community members, we've got doctors, policymakers, people who run patient organisations. And one of the things that we're looking at exploring is if the rare disease community, which does tend to be focused on people being poorly and needing to be fixed, is there greater strength in our community in more closely aligning with the disability rights community, who work more on a model of having needs that need to be met rather than being deficient or deficit in some way because of their needs. So we're trying to light a fire in our community to understand that they have rights and they can have those rights met if they exercise them properly.
Where is it, and do you need a ticket?
Yeah, you do need a ticket. It's at Stoke Town Hall, and all information is available on Metabolic Support UK's website. And we've come to Stoke specifically, Stuart, because we want to move these conversations out of corridors of power and the usual suspects of Oxford, Cambridge and London for rare disease. So we're asking people to have an oatcake in Stoke and not just a vol au vent in Westminster.
I know where I'd rather be. I'll stay here. Yeah. Thanks very much indeed, rather than a vol au vent. This is fascinating. Let us know how you go on. And if people listening this morning want to get involved, have a look, as we've heard there, on the Metabolic Support UK website. Kirsty, thank you so much for raising this, which clearly affects lots of people, but there's such fragmented and disparate groups that trying to bring them together can only be a good thing, surely.
Absolutely. We've got strength in power and our collective approach. And so anybody interested in whether living well or dying well with a rare disease, which is a big part of our community, 30% of children with a rare disease die before their 5th birthday, sadly. But these are things that need to be talked about in our community. Come and join us and come and join the Living Well movement.
Thanks very much for speaking to us. Kirsty Hoyle is CEO of Metabolic Support UK, running this event at the Town Hall in Stoke on Friday. If you want more details, have a look on their website.